MAP is both a comprehensive diagnostic on the state of financial inclusion, but also a stakeholder process, which is meant to help the government to define their own strategies around financial inclusion and their roadmap. And I think it changes the nature of the discussion around financial inclusion in the countries where we work in several ways. I mean, first, as a diagnostic, MAP is enabling us to have a deeper look on the demand side through the application of the FinScope demand survey. And that's really enabled us to have a much greater insight on how people access, use, and value financial services. MAP is also a comprehensive diagnostic around the supply side and the regulatory side. And the combination of these different dimensions is really enabling us to have a comprehensive view on what is driving financial inclusion, but with a very strong client-centric approach. I think as a stakeholder process, also what is interesting with the MAP approach is that it has really brought around the table a larger range of stakeholders, both from the government, so basically reaching out to ministries which didn't used to be part of the financial inclusion discussion. And I mean by that Ministry of Telecom around mobile money, Ministry of Agriculture around agriculture finance, Ministry of Social Affairs about social payment and how these could also contribute to a greater financial inclusion. So that has also changed completely the nature of the engagement and a broader sense of ownership at the national level on what drives financial inclusion. It has also been a tremendous platform to bring in the private sector because the data coming out of MAP reveals new markets, shows new opportunities for the private sector to extend the outreach of their own services, whether it's credit, saving, insurance, remittances, payment, to the unbanked segment of the population. So I would say, in short, MAP has really enabled us to get a deeper understanding of the drivers of financial inclusion, a broader engagement of stakeholders in order to shape, a common vision and a roadmap by the countries around financial inclusion. And at the end of the day, what we see emerging is a stronger ownership by those governments around their financial inclusion strategies and roadmap, backed by really concrete and comprehensive data and evidence-based analysis around what needs to be done to really push financial inclusion forward. I think the MAP program has led to a much better understanding of the client needs for several reasons. The MAP diagnostic itself includes a very comprehensive assessment of the demand and access through the FinScope survey, which was developed by FinMac Trust, who is our close partner, along with Senfree, in deploying MAP in now 15 countries. And when you look at the FinScope surveys, it really puts the customer at the center, understanding how they access, they use, they value financial services. And it enables us to look at that through the range of financial services they use, from payment to credit to saving, and to insurance as well. And also look at how they use this different financial service stream to address different needs. It really enables us to understand the client financial journey through the need that they have and how they use different financial services or type of financial services to fulfill those needs. If I take very specific example about some of the insight notes which are coming out of MAP, it sheds a completely different light on understanding that customer journey. We realize that in Myanmar, farmers access a substantial amount of credit from the Agricultural Development Bank, but they use part of that credits not for productive purposes, but for insurance purposes. And that leads to a misallocation of capital and lost opportunities. It really helps us to understand that in order to support increased productivity of farmers in Myanmar, you don't need to give them more credit. You need to create a risk mitigation instrument which will enable us to use the credit they already receive more productively, instead of keeping part of it aside for security purpose, with an insurance purpose. Similarly, the market segmentation that we have done enable us to look at the disconnect between how poor people in Swaziland face a very high burden of disease, for example, to cope with the impact of HIV/AIDS, and if you compare the incidence of death in the family linked to illness, compared to how many people have access to insurance services, you realize that there is a huge gap there. And it compels us to think of how to create a simple insurance product which would enable them to cope for that risk. And the third example is that we always assume that dependent, so a recipient of remittances, young people, this strata of population who wouldn't, we think, directly use financial services actually are active consumer of those financial services. So the FinScope data from the MAP diagnostic suddenly reveal a whole new market that we didn't know, and which is already, actively using a range of financial services or needs those financial services for different purpose. And so that again, creates a whole new insight about how to, incentivize a financial service provider to cater for those needs in these different market segments. I would say that MAP has radically changed our view on the client and customer side based on reliable data, and it has enabled us to link that data analysis to action, to basically looking at underserved market segment, smart policies, incentive, and engagement with the private sector to cater for those needs.